Hello, my name is Isabella Imakuchi, and in this video, I will be reviewing the first half of the text, DBT Made Simple.
And my name is Kulthoom, and I'll be doing the second half of DBT Made Simple
By Sherry Van Dyck. Before we get started, what is DBT? DBT is known as dialectical behavioral therapy, and it was created in 1980 by an American psychologist, Marsha Lindheim, and her team. They were studying ways of treating behaviors related to suicide. This focus was later moved to borderline personality disorder, also known as BPD. BPD is an illness that causes individuals to have difficulties regulating their emotions, impulsive behaviors, with increased chances for suicidal behaviors and self-harm. The first chapter, the basics of dialectical behavioral therapy. So, in continuation, what is DBT? DBT is a principle-driven cognitive behavioral therapy, protocol-based therapy. DBT is a form of CBT with the addition of mindfulness and acceptance techniques and the removal of judgments. There is an encouragement for clients to accept their thinking, and this allows them to make changes so their thoughts are more balanced. The DBT modality encourages people to unlearn the destructive behaviors by identifying the triggers for said behavior and contingencies that uphold these behaviors. In DBT, clients are learning how to accept themselves as they are and gain new tools to cope with behaviors in a healthy way. What is emotional dysregulation? This is the result of high emotional sensitivity or vulnerability combining with an inability to regulate one's emotions. Emotional vulnerability is a biological predisposition / temperament where an individual is born more emotionally sensitive than most people. Their emotional reaction is not always effective for the situation. An inability to regulate emotions / emotional regulation refers to the processes we use unconsciously, consciously, or with a tremendous amount of effort to decrease, maintain, or increase an emotion or aspects of an emotion. This coincides with the biosocial theory of BBD. This theory is described as emotional dysregulation by biological predispositions and each individual's reaction with their environment. The invalidating environment is when a child expresses an emotion, a private experience, and the people in their environment judge the child for this experience. This can look like telling the child they shouldn't feel this way or that they're overreacting. Tell them that their experience is incorrect or minimize them. Punish them for talking about their experiences, ignore expressions of their experience, and this list can go on. The following slides will outline the 4 main types of invalidating environments. Number 1, the poor fit. Sometimes children are born into families in which they don't fit properly. For example, a creative child is born into a family where their parents and siblings are practical and see their creativity as a waste of time due to the financial independence and therefore should not be pursued. Number 2, the chaotic home. Sometimes parents were invalidated as a child, and from this, they never learned how to validate themselves or others. Parents who have untreated mental health problems of their own, addiction, or financially unstable, having much more difficulty providing the necessities of life, which affects their abilities to provide their children with an emotionally safe and healthy environment. Number 3, the abusive home. Taking many forms in physical or sexual abuse, individuals receive further invalidation from abusers when they speak up about their abuse. More often than not, individuals are told they're lying, disbelieved, and sometimes blamed for the abuse. Number 4, other invalidating environments. Although the family and home environment play key roles in childhood development, invalidation is not limited to just being experienced at home. It can happen at school, church, babysitter's house, being around other family members, engaging in extracurriculars, and etc. A transactional model. The biosocial theory is dialectical or transactional, meaning interactions will take place over time between the environment and the individual, which gradually leads to the adaptation to one another. And this is the development of borderline personality disorder. The dialectical theory of DBT. In creating the treatment model of DBT, Linehan was influenced by the theory of dialectics. Everything is interconnected or interrelated. Reality is a process of change. The truth can be found by integrating or synthesizing differing views. In DBT, both therapist and client need to accept the client as they are and also need to continue working towards changing behaviors that are unhealthy or self-destructive. Looking at the DBT model, there are many different types of skills. Looking at the skills training group is a psychoeducational structured group. Taking place once weekly is developed for clients to enhance capabilities. Core mindfulness skills. Aim of mindfulness in treating borderline personality disorder is reducing confusion about the self, but is not limited to BPD treatments. Through mindfulness, clients have learned to tolerate thoughts, emotions, and urges they don't control, seeing how internal experience don't have to be acted on, and simply acknowledging the existence of thoughts, actions, or urges, and these experiences will gradually dissipate. Interpersonal effectiveness skills. The aim of these skills are to reduce the interpersonal chaos that is present in the client's lives and how to be more assertive. Clients are taught skills on how to be able to achieve their goals effectively. Emotional regulation skills. Clients are taught general information about emotions, the why we need them, and the why we shouldn't suppress them, even when they can be so painful. By changing either our thoughts, feelings, or behaviors, this has an impact on self-validation in these skill sets, along with other skills to manage emotions effectively. Distress tolerance skills, also known as crisis survival skills. The intent of teaching these skills is to aid clients in surviving crisis without worsening things by engaging in problem behaviors. Individual therapy. Individual sessions for dialectical behavioral therapy usually occur once weekly. These sessions have more emphasis on individual target behaviors and exploring how to use some of the skills that can be applied to these behaviors. For example, substance use or self-harm. Telephone consultation. The purpose of this is for brief interaction between client and therapist to help identify which skills they can apply to situations the client may be facing in overcoming obstacles. The consultation team. According to Lindheim, there is no DBT without the team. Typical team consists of social workers, psychologists, psychiatrists, and anyone else who is working with DBT service users. The team is used in two ways. First, in supporting therapists and helping each other develop DBT skills/practice, and the second is for case discussion. It's important to be flexible with DBT. Being able to provide the full model of DBT is ideal, but it's not always possible. Incorporating some DBT skills into practice, for example, mindfulness, acceptance skills, or validation, can go a long way for some people's clients. Looking now at Chapter 2, Preparation for the Individual Session, What You Need to Know. DBT Assumptions. In Marcia Lindheim's book, she describes a set of assumptions about BPD from the DBT perspective. These assumptions are not always accurate, but going into a session with some assumptions in mind can help develop a better relationship and understanding of the client. Clients are doing their best. This reminds the therapist that clients are doing their best regardless of their diagnosis. They are doing as well as they can with what they know. This also reminds therapists that not everyone has the same privileges of growing up learning emotional regulation or problem-solving skills. Second assumption is that clients want to get better. If a client is making a voluntary decision to seek therapy, it's safe to assume there is a desire to make positive life changes. Therapists should remember this assumption helps reduce preconceived assumptions about the client and be more willing to help their client succeed. Number 3, clients need to work harder and be more motivated to make changes in their lives. Teaching clients the skills to live a more positive, meaningful life helps place the responsibility on clients to make changes in their life and less on the therapist to fix the client. Number 4, even if the client didn't create their problems, they still have to solve them. Clients must enact changes on their own while being coached/guided by a therapist to make those changes. Remember that therapists are not fixing the clients. Number 5, the lives of suicidal clients are unbearable. If a client attempts suicide, the first reaction from the therapist should not be to figure out what the ulterior motives are. You need to assume that the client found their life unbearably painful and they tried to kill themselves because of this. Number 6, clients need to learn to act skillfully in all areas of their lives. Clients have difficulties with emotional regulation, have still become successful in their professions. However, just because they are using some of the DBT skills in one aspect of their life doesn't mean the client is well equipped with necessary skills to problem solve all issues in their life. Number 7, clients cannot fail psychology. If a client doesn't make progress or drops out of therapy, the client isn't to blame. The fault lies on the therapy, the therapist, or both. Either the mode of therapy wasn't a good fit for the client, or the therapist hasn't been implementing the therapy effectively. For therapists and clients, there's some trial and error in figuring out an effective treatment method. Therapists treating clients with emotional dysregulation need support themselves. BPD and emotional dysregulation are generally among the most difficult illnesses to work with in psychotherapy. Due to high emotional sensitivity in these clients, therapists must unconsciously and inadvertently therapists may unconsciously and inadvertently invalidate or alienate clients, and therapy abruptly comes to an end. This is why in DBT, there is an emphasis on the treatment team. Reducing burnout with DBT, boundary setting versus observing limits. Boundaries are more concrete and movable. By setting a boundary, it becomes the client's responsibility not to cross it. Any behavior that crosses the boundary is pathologized and considered inappropriate. Observing limits. Responsibility falls on the therapist to maintain your limits, while clients may exceed them. This emphasizes not the client's behavior, but your own personal and professional preferences. Everyone's limits are different, and these can be changeable. Consultation to the client. Likewise to observing your limits, this concept is intended to help minimize burnout and enhance your effectiveness in therapy. The role of the therapist in teaching the client how they can interact with others. People should be consulting the client about their needs rather than the therapist. The stages of treatment. According to Linehan, there are 4 stages of treatment. Pre-treatment, attaining basic capacities, stage 1, reducing post-traumatic stress, stage 2, and increasing self-respect and achieving goals, stage 3. The pre-treatment stage, orientation and commitment. There is a link for the use of pre-treatment orientation strategies and a reduction in therapy dropout rates. Since the dropout rates from clients tend to be high, the first few sessions of DBT focus on having the client and therapist decide on if they're willing to work together. The therapist works on completing an assessment with the client, providing psychoeducation about clients' diagnoses, and reaching a commitment to therapy by setting some goals. Stage 1, attaining basic capacities. Once therapist and client establish a working relationship with each other, they will enter stage 1. This stage has a focus on behaviors that pose immediate threats to the client's safety or stability. The goal of this stage is reducing suicidal behaviors, thoughts, as well as other harmful, unhealthy behaviors, and address skill deficits. Stage 2, reducing post-traumatic stress. The trauma becomes the focus, and the use of exposure therapy helps to emotionally process past trauma. Not all clients have a history of trauma. Stage 2 can also be a focus on the negative relationships experiencing that clients with emotional dysregulation issues have and lack of interpersonal skills. Stage 3, increasing self-respect and achieving individual goals. During stage 3, the goal focuses on helping service users work on trusting, valuing, and respecting themselves, in addition to continuing the work on generalizing the skills they have learned in therapy to the rest of their life. In Lanhan's book, she points out that it's not unusual for clients to move between stages in a non-linear way. For example, moving from stage 1 to stage 2, then back to stage 1, then moving back to stage 3, and so on. Moving on to chapter 3, the B in dialectical behavioral therapy, what you need to know about behavior therapy. Reinforcement. By reinforcing any behavior, this is the cause for its occurrence to most likely happen again. There are a variety of ways this can be done through positive, negative, and intermittent reinforcement. Positive reinforcement. Something the person sees as positive happens after they engage in a certain behavior. While rewards are an obvious and intuitive form of positive reinforcement, this dynamic can be much subtle, and complex. Negative reinforcement. This isn't about punishment, it's still reinforcement, but in this case, it occurs by taking away something that the person finds aversive. In other words, negatively reinforcing a behavior means that something the person finds unpleasant is removed after a certain behavior occurs, making it more likely the person will engage in that same behavior in the future, in order to have an unpleasant experience removed once again. Intermittent reinforcement. This is actually one of the most successful ways of reinforcing a behavior, since the person never knows when they will be reinforced. The most applicable example is in gambling. The slot machine intermittently reinforces the person for putting coins in the slot and pulling the handle, and every now and then the card player is dealt with a winning hand. Remember that reinforcement will look differently for everyone. Consequences. Refers to the effect, result, or outcome of something that occurred earlier. When looking at the consequences of a person's behavior, we're asking what happened after the person had acted. Negative consequences. Most often we think of consequences in terms of negative outcomes. While it's certainly important to look at the negative consequences of a person's behavior, it's just as important to remember that there are often also positive consequences. Positive consequences. If you keep in mind that a positive consequence is simply the result or outcome of something that happened earlier, it's easier to understand that consequences don't have to be negative. Functional behavior also has consequences, and it's helpful if clients experience this, receiving positive reinforcement for acting in healthy ways. Shaping and modeling. Shaping. By reinforcing behaviors that are close to the desired behavior, you can shape an individual's behavior. Modeling is about demonstrating a behavior for someone else to imitate. In DBT, it's important for therapists to model the use of skills in session. Clients also learn behavior by modeling other people, and unfortunately, this means that they won't be always modeling healthy behaviors. When this is the case, it can help if clients see where they learned this behavior so they can choose whether they want to continue the behavior or learn a new way of behaving. Contingency management. Contingency refers to a relationship between two events where if one event takes place, the other event is more likely to occur. In DBT, contingency procedures are based on the assumptions that the consequences of a behavior will affect the probability of the person choosing to engage in the behavior again. Contingency management, then, is about utilizing therapeutic contingencies to benefit the client. In other words, therapists must be aware of how their behaviors are likely to affect the client so that they don't inadvertently reinforce unwanted behaviors or punish or neglect to reinforce desired behaviors. Problem-solving strategies, the behavioral analysis. Completing a thorough analysis of a target behavior is the first step in problem-solving or stopping a target behavior. Before you can take steps before eliminating the problem behavior, you must first understand it. The behavior analysis should initially be completed by therapist and client together to ensure that the client understands how to complete it. The goal is for the client to learn how to do thorough and accurate behavioral analysis on their own when a problem behavior occurs. Continued of the behavioral analysis. A lot of attention should be devoted to the solution analysis, helping clients come up with ways to reduce the likelihood that the behavior will occur again. Assist them in looking at each of the links in the chain. Once service users have learned some of the DBT skills, they will have more options in terms of what they could have done differently and where they might intervene with skills the next time the urge arises. Chapter 4, DBT Strategies for the Individual Session. Communication styles, reciprocal communication. This is about sharing with the service user, the give and take part of the interaction, being warm and genuine, and treating the client as an equal. Therapist self-disclosure. Therapist self-disclosure is also supported by humanistic therapies as a way of engaging the client in an authentic relationship. Linehan noted that the effectiveness of many DBT strategies is reliant upon the strength and genuineness of therapeutic relationship. Van Dyck uses the example by Carl Rogers in 1961, where they put forth the idea that therapeutic relationships can be more genuine and real when therapists are able to be who they are, rather than putting on a facade for the service user. Guidelines for self-disclosure. There is a dialectic tension between the concepts of you cannot just push for change, there must be an acceptance of for each service user as they are, validation, and push for the change simultaneously. The goal is aiming for a balance. There are so many therapists who have employment experiences that regard therapist self-disclosure as inappropriate. Validation. Linehan defines validation as communicating that the client's responses make sense and are understandable given what's currently taking place in their life. Validation means taking the client's responses seriously rather than discounting them or minimizing them. There are 6 levels of validation: listening and observing, accurate reflection, articulating the unverbalized, validating in terms of sufficient but not necessarily valid causes, validating as reasonable in the moment, and treating people as valid, radical genuineness. Irreverent communication. The dialectical opposite of reciprocal communication. Irreverence is about being blunt and confrontational, making use of honesty and a partial sense of humor at the same time. There's a reliance on a well-developed therapeutic alliance, as well as the therapist to have a good understanding of how the client may respond to this type of communication. Dialectical strategies. Devil's advocate. Playing the devil's advocate is a technique used in the beginning stages of therapy as an attempt to obtain commitment from the client to engage in DBT. The essence of this technique is that by arguing against something, the therapist can help the client argue for it, and through this process, a synthesis can be achieved. Use of a metaphor. Linhan stated that using metaphors helps to provide an alternative, interesting way for teaching service users how they can think dialectically. Metaphors are flexible. This allows service users to use them for different reasons in their own way. Making lemonade out of lemons. In DBT, this requires therapists to take an apparent problem and turn it into something positive. As Linhan points out, this is another skill that must be used with caution so it does not seem like invalidation of the client or minimizing any seriousness of the problem. Goal setting in DBT. Goal setting can be a complicated stage and will progress over time as therapists build rapport with their client. Although the therapist and service user are discussing a goal or target, this doesn't mean the service user is immediately expected to accomplish it all at once. The purpose is to agree on an achievable goal to work towards. The role of validation in setting goals. Telling the service user that they need to or should change a behavior is inherently invalidating, as it indicates that there is something wrong with the behavior and by default with the service user for engaging in this behavior. It is a good practice when conversing about goal setting or target behaviors that the service user is validated. When disagreements arise about setting goals, therapists and service users may not always come to the same agreements while goal setting and to create a life worth living. Two DBT approaches look at examining the cost/benefits and acceptance. Examining cost/benefits. Considering the cost or negative consequences of a behavior can help the service user see that changing the behavior is a goal. Acceptance. Service users are likely holding themselves back from goal setting out of fear. Although the therapist is accepting of this refusal at the time, as an outsider perspective to the service user, they may point out at times when a behavior has more negative consequences than positive. Homework. If the purpose of homework is for it to be helpful, it should be approached in a collaboration between the therapist and service user. Otherwise, the service user may not see the point to it. At the start of the next session, always address the homework that was assigned previously. Incorporate this while looking at the service user's behavior tracking sheet. Because the therapy consists of likely 1 hour per week, it is important for the service user to complete their homework. Ending therapy. Linhan notes the importance of preparing clients with BPD for the eventual termination of therapy from the very beginning. Rather than making the assumption that there will be no further contact, the therapist and client should discuss whether or not they want to have ongoing contact with each other, and if so, what are the limits surrounding this? Seeing someone weekly or bi-weekly for such a long period of time and then no longer being able to have contact with this person is much more difficult to accept than a gradual reduction of contact, especially for clients with BPD, who have probably had lifelong difficulties with their relationships. Chapter 5, Introducing Clients to Mindfulness. What is mindfulness? An awareness focusing on this present moment, concentrating all of your attention on whatever it is that you're doing in that moment. That could be driving, eating, or reading. And acceptance, being aware of your experiences without judging it. For example, you notice you're feeling anxious, but you accept it without judging it as something else. Selling mindfulness to clients. As a therapist, it is their job to convince service users that incorporating mindfulness into their lives will be useful for them. It is crucial to take into consideration the problems they've stated that they want to work on, and then explain to them how mindfulness can help them with these target behaviors. The following are some typical problems mindfulness can help with: taking control of your mind, improving emotion regulation, increasing behavioral control, improve concentration and memory, engaging in your life, and relaxation. How you can practice mindfulness. Choose an activity. Next, focus on the activity. After that, notice when your attention begins to wander. And then once you do, gently focus your attention back on the activity. Mindfulness isn't about staying in the present moment, but it's about noticing when your attention has wandered and returning it to the present moment. The author further states that clients can understand that mindfulness is difficult, and helping them believe that they will be able to do it can be very helpful in getting clients to practice mindfulness. Informal and formal mindfulness practice. Informal mindfulness. The concept of informal mindfulness simply brings mindfulness to wherever you happen to be and what you're doing. Reading a book, talking on the phone, going for a hike, etc. By participating in informal exercises, this helps clients live their lives more mindfully and be in the present moment more often. Formal mindfulness. This concept of formal mindfulness takes place once you actually make time to work on an activity. The use of formal exercises can help clients become more aware of their internal experiences, which additionally increases self-awareness and the ability to manage their lives more effectively. Make it easy. Mindfulness is not an easy practice to pick up, but if the therapist makes the skill as easy as possible to understand, there is a greater chance that the service user will use the skill in their regular life. Making the lessons as personable as possible helps the service user focus on an activity they already can be focusing on. This can be an effective way to begin mindfulness practice. Practicing what you preach. Having had your own practice with this skill is important from a more practical perspective. How can a therapist effectively teach their clients how to do something if they're not doing it on a regular basis themselves? This is not to say that therapists will be experiencing the same problems as their clients or even to the same degree, but it helps give them a better understanding of what their clients' experiences are, and also therapists to model these skills. Problems clients frequently encounter. It makes me more anxious. I just can't do it. I just don't have time. I can't stay focused. I already focus on the task at hand. I fall asleep. I have to multitask. Isn't mindfulness just avoiding or repressing? But you have to plan for the future. It is justifiable to run into these problems when introducing mindfulness to service users. They have only known how to live with the skills they have had all of their life. And while this practice can be beneficial, it is still a major change. Change can invoke fear or anxiety for many. Always validate your clients and have open dialogue with each other about this skill. Chapter 6, Additional Skills for Mindfulness. Mental noting. To better assist your client when they are first introduced to practicing mindfulness, it can be helpful to break the skill into smaller steps. Mentally noting events as they occur. This concept of mental noting, also known as witnessing, is a DBT skill Lenhan calls observing and describing. Simply observing. By mentally noting your emotions, this helps service users not get too caught up by them. An example of an emotion like this is anxiety. This feeling escalates easily because the very feeling of anxiety often stems from fear, which makes people feel more anxious. If you simply just observe the anxiety, it can prevent or at least reduce the possibilities of it escalating. Mental noting internal versus external experiences. The difference between internal and external events is that internal events take place from inside ourselves. This includes our memories, thoughts, images that enter the mind, urges, emotions, and physical sensations, whereas external events are occurring from outside the body. Therapists should ask service users who are very in tune with their internal experience to mental note their external experiences, and for service users that are more in tune with their external experiences to do the opposite. Practicing mental noting will help clients become more balanced, helping increase their awareness of both internal and external experiences. This also helps to enhance their ability to manage their emotions. Leaving the judgments out. If the therapist chooses to teach the skill of being non judgmental to clients, they most likely have done so because they believe that it will be a useful skill for their client. The skill of being non judgmental is harder for some service users to practice. What is a judgment? The word judgment is referred to as the act of assessing or evaluating someone or something as either being positive or negative. For many people, their first exposure to judgments were from a very young age. Being immersed in a judgmental environment for so long causes our brains to become judgment machines. The problem with judgments. Making judgments is an automatic behavior. Therefore, trying to catch and stop yourself from passing a judgment is very challenging. As the therapist, part of your role is to convince service users that this skill can be beneficial for them. By practicing this skill, it can help reduce harmful behaviors and in turn benefiting the life of the client. Judgments add fuel to the fire. It is most common that when we make negative judgment, it comes from a painful emotion we're currently experiencing. When people feel hurt, angry, disgust, or another painful emotion, an automatic response to these emotions causes them to judge. Therefore, judgments can lead to increasing the intensity of emotions, and this traps people in a vicious cycle. This concludes the first part of the DBT Made Simple book review. My colleague will now continue the review in part 2.
The word judgment is when someone determines someone or something as either positive or negative. Sometimes a judgment can be misunderstood and hurtful. When a person is angry, hurt, or in some type of emotional pain, these types of emotions will make a person start making negative judgments. The problem with that is the more a person will judge, it will increase more emotional pain and trap him in a vicious cycle. Clients may want to vent to their therapist and say that letting it out would make them feel better, but they should be asked if that would really help them and make them feel better. Research also indicates that feelings of anger increases when a person vents while being angry and judging at the same time. One of the reasons self-judgment is hurtful is because it tends to be especially problematic for emotionally dysregulated clients. When a person is constantly being told negative things, they will automatically start to judge themselves and they will start to feel that whatever is being said to them is true. To change judgments, it is important to be aware of them. Service providers can politely point out clients' judgments during sessions and try to get the client to see the judgment in a non-judgmental or neutral way. Validate the client and self-disclose about your own judgment if appropriate. Chapter 7, Helping Clients Reduce Emotional Reactivity. In this chapter, we will discuss 3 styles of thinking, how to access your wise self, and addressing lifestyle issues that affect emotion regulation. The 3 states of mind or ways of thinking, which are described by Linehan, are the reasoning self, the emotional self, and the wise self. The reasoning self is when a person thinks logically or reasons something. Generally, in this state, no emotions are involved, and if they are, they don't really influence how we behave. The second state of mind or the way of thinking is the emotional self. This is when a person's behavior is controlled by her emotions. This usually gets the person in trouble. The last state of mind is the wise self. This is a person who feels emotions but is still able to think straight and logically. He still weighs the consequences of any actions and chooses to act in a way that is best for him in the long run. Now that we have a clear understanding of the 3 styles of thinking, we will move on to talking about how to access your wise self. To help clients access their wise self, help them by assisting them to talk nicely and kindly to themselves. Clients can access their wise self through the mindfulness skill. One form of mindfulness is focusing on the present moment. This will help them rationalize good decision making. Also, by practicing mindfulness, they can distract themselves from painful emotions. Another way for clients to access their wise self is self talk. This will help clients remain in the moment more often rather than thinking about some mistake they made and judging themselves for it. A third skill that clients can use to access their wise self is by practicing the skill of focusing on just this moment. The more clients practice this, the more ability they will have to access their wise self. This chapter wraps up by addressing lifestyle issues that affect emotion regulation. One of the main issues that affect emotion regulation is not enough sleep. It is difficult for a person to function without enough sleep. Sleep deprivation causes a person to remember emotional situations as more negative than they actually were. Although sleep deprivation is an issue for some people, people also use sleep as a way to escape when emotions are tense on them and they don't know how else they can cope. But what people don't realize is that sleeping too much can reduce their ability to regulate emotions. The only way to cure this is by helping clients balance their sleep, making sure they're not getting too little or too much sleep. Another main issue that affects emotion regulation is physical illness. It often makes it more difficult for people to manage their emotions. Having serious medical conditions can cause another emotion regulation. When they go untreated, they create sensations in the person's body that will make the person feel that he has anxiety or depression, or make that person more vulnerable to his emotions. Drugs and alcohol are also an issue that affect emotion regulation. They are called mood altering substances because they alter a person's mood, and the person has no control over his or her actions or mood. Practitioners can help clients see it as a problem, and if they are willing to do so, they can help clients set small goals of reducing the amount they take. Not eating can also affect the mood, and not getting enough nutrients or not eating enough can possibly be the result of anxiety and depression. To wrap up this chapter, encourage clients to do exercise, as it is a great way to release chemicals from their brains that help them relax. It is also responsible for having an effect of a positive mood. It is also important for clients to think of the three states of mind and practice on accessing the wise self. Chapter 8, helping clients survive a crisis, distress tolerance skills. In this chapter, we will focus on identifying problem behaviors, examining the cost and benefits of problem behaviors, and resisting and managing urges. Sometimes when things get out of control with a person, our main focus should be just keeping the person alive. When identifying problem behaviors, the first step is to help the client raise his awareness and to find out what behaviors are unhealthy or self-destructive. Example of behaviors can be drinking, using drugs, or self-harming. When clients need help seeing what kind of behaviors have cost and what kind has negative consequences, that is when the DBT skills of looking at the pros and cons is used. Clients should not hold anything back and write down everything that would come to their mind. Also, doing a cost-benefit analysis will help them to come to terms so they can make a more conscious decision whether to engage in the behavior or choose to act a different way. Lastly, this chapter ends by talking about managing and resisting urges. It is often very hard for clients to change their problem behaviors, but there are ways we can help clients resist and manage the urges. In DBT, they are known as crisis survival skills with the acronym RESIST. The R stands for reframe, which means for a person to change his perspective of something. The E stands for to mindfully engage in an activity. This means when a client is in a crisis or in a painful situation and their emotions are really high, you want to help them distract themselves with different activities that will keep their attention firm on it. The S stands for to do something for someone else. An effective way for clients to take their mind off their own problems is by doing things for another person. This will distract them and keep their focus on something else. The I stands for experience intense emotions or sensations. Sometimes, when a person has painful emotions, he distracts his mind by giving himself intense physical sensation. An example for this would be cutting or hurting himself in other ways. The S stands for shut it out. Sometimes being around certain people can have an effect on a person's emotions. The best thing to do in this situation is to get up and leave and go somewhere where it is quiet and the person can feel peace and access his wise self. The T stands for to think neutral thoughts. When a person focuses on natural thoughts, it can provide a distraction from urges and emotions. The second T stands for to take a break. When a person is in a crisis and his emotions are really high, the most helpful thing to do would be to take a break so the situation does not get worse. Sometimes urges may arise, which is why the practitioner and client should come up with a plan. It may be helpful to use a worksheet steps to managing your urges. Also help clients cope ahead when they know that an upcoming situation will be difficult, so then they can deal more skillfully and effectively. This here is a snapshot of the worksheet. You can pause the video here to look over it. This next chapter, chapter 9, is what clients need to know about emotions. In this chapter, it goes over what is an emotion, the role of emotions, and the connections between emotions, thoughts, and behavior. According to Marshall Linehan, an emotion is a full system response because it does not only include the way we feel, but also the way we think. Emotions also trigger psychological reactions that cause changes in body language and in body chemistry. It is also important to provide general education of emotions to clients before teaching them specific skills that will help them manage their emotions. Most clients often want to get rid of their emotions, but it is important to make them understand that getting rid of them isn't a realistic goal. We need to help them understand why we need emotions. One role of emotions is motivation. For example, fear motivates us to flee. Another role of emotions is information. Emotions also provide information regarding situations that we want to change so they can become better to suit our needs. The last role of emotions is communication. People communicate more effectively with the help of emotions because some emotions are a part of them and they stimulate universal facial expressions and body language. To end off this chapter, let's discuss the connections between emotions, thoughts, and behaviors. The way we think and the way we behave is mostly affected by our emotions. Also, the way we feel and behave in this situation, it is mainly influenced by our thoughts. Since all three of them are connected, it can be really easy to confuse them. A useful tool to manage emotions for clients is to name the emotions they are experiencing. Some clients may tend to use generic emotions, but as a practitioner, it is important to dig deeper and find other emotions the clients may be feeling. Chapter 10, Skills to help clients regulate emotions, reducing painful emotions. In this chapter, it covers types of emotions when being mindful, self-validation, and accepting reality. There are two types of emotions when being mindful: painful emotions and positive emotions. When a person is mindful of painful emotions, it leads to accepting his emotions as how they are without judging them and pushing them away, and does not try to get rid of them. He accepts them as a part of life. And when a person is mindful of positive emotion, it entails him to accept his emotions as they are, enjoy them while they last, rather than worrying whether he deserves to feel that way or not. Self-validation is a DBT skill that is known as accepting emotions. In therapy, a lot of time and effort should be devoted to validating clients and to gradually help clients learn to validate themselves. This chapter discusses some important information about emotions so we can have a better background when it comes to practicing self-validation. The therapist and the client both need to understand that everyone receives different messages about emotions. For example, growing up, many people learn that anger is a bad emotion. It can also be helpful if you help them think about the messages they've received about emotions in their life and make them understand which ones are bad and which ones are okay to have. And while pointing out you're only talking about emotions and not behaviors. Another important point related to self validation is that there are two types of emotions: primary emotions, which are those we experience when something happens, and secondary emotions, which are the way you feel about your feelings. Now, let's continue by talking about practicing self validation. When validating an emotion, it does not mean to judge it, but it means accepting it. There are three levels of self validation. The first one is acknowledging the emotion rather than judging it. The second is allowing yourself to feel the feeling. And the last one is understanding, meaning telling yourself it's okay to feel it while also understanding it. One helpful thing for clients when it comes to self-validation is for them to write down a list of validating statements that they can read when they notice that they are invalidating themselves. To end off this chapter, we will finish off by talking about accepting reality. Although accepting reality isn't easy, in DBT, it's emphasized to work on accepting reality in general, because when someone fights reality, it will cause suffering, which is not avoidable. Acceptance is simply about whether or not a client wants to continue spending so much energy and having so many painful emotions about things that are out of their control. It is important to mention to clients that the word acceptance has nothing to do with approval or being okay, rather, it's non judgmental. There are 4 steps to practice accepting reality. The first step is for the clients to decide if he wants to accept that situation. The second step is if he does want to accept the situation, then help him make a commitment to himself to accept whatever reality he is fighting. It's likely he will start fighting reality again. So the third step is for him to notice when he does. The final step is to turn his mind back to acceptance. Lastly, as we continue to work with clients, remember to use a lot of validation and encouragement. And also remember that they are looking at us for guidance. Chapter 11, Skills to help clients regulate emotions, increasing positive emotions. In this chapter, we will be going over being effective in life, increasing positive experiences, willingness, and willfulness. One important factor for positive emotions is that they strengthen the immune system and heart and help minimize impact of painful experiences, including trauma. In DBT, the skill of being effective refers to doing what you need to do to get your needs met or move closer to your long-term goals. The more effective clients start being, the more positive emotions they will start experiencing. Being effective can be really challenging for clients because their emotions often come in the way. When clients start acting from their emotional self, it is hard for them to determine what their long-term goals are. And when they do not know their long-term goal, it gets in the way of their ability to be effective. That's why it is important to provide a lot of validation when teaching clients this skill. Now let's discuss helping clients increase positive experiences. To help clients increase positive experiences, we need to make them understand that positive emotions don't just appear, especially when they are in emotional pain regularly. We have to explain to them that it's their responsibility to work on generating positive feelings so they can increase positive experiences. As for clients who experience emotional pain regularly, increasing pleasurable activities can be hard for them too, but it is important that they try working on increasing it. Clients who are always unmotivated or their emotions are always out of control, their mood isn't going to improve until they start doing enjoyable activities. If they don't do anything, they're just going to be in a cycle and they're not going to feel peace. One way of promoting change and achieving pleasurability is to help clients examine their goals. To finish off this chapter, we're going to discuss willingness and willfulness. Willingness is about acceptance and taking an attitude of openness toward life or choosing to enter into life fully, regardless of the challenges this entails. Willingness is also doing your best to access the wise self and be effective. Willfulness is giving up and refusing to try or to even consider what may be possible. We need to encourage clients to see behaviors as signals of willfulness and also to encourage them to accept their feeling willful after we help them identify what they do when they feel willful. After that, ask them to think of willingness as opening themselves to their experience, to learning, and to possibilities. By thinking this, it can help change the attitude, and by expressing, it can physically help them become a more willing. Chapter 9. Chapter 12, helping clients become more effective in relationships. In this chapter, we will discuss social support, communication styles, assertiveness, and deepening current relationships and developing new ones. Every human needs people in their lives to be happy, and all relationships can impact a person's mood. So, as practitioners, we need to assess clients' social support early on in therapy. We need to help them examine the quality of their relationships, whether they are healthy relationships or not, and what kind of emotions are involved in those relationships. One important thing to remember is quality over quantity. And that matters the most. It is not about how many friends they have, but rather how satisfied or fulfilled they are by these relationships. Communication styles. Sometimes they can have a negative effect on relationships. The following 4 communication styles can be helpful to mention to clients so they can understand how they might be causing problems in their relationships. The first one is passive communication. These people don't communicate verbally, they usually fear confrontation and they bottle up their emotions. They show a lack of respect for oneself and their own needs are not met. The second one is aggressive communication. This is when a person attempts to control others and his goal is to get his way, regardless of others. The person is direct, forceful, demanding, and vicious, and he might get what he wants, but at the expense of others. The third one is passive aggressive communication. This is when a person fears confrontation. He doesn't express himself directly, instead, he uses sarcasm or silent treatment. Passive aggressive is seen as manipulative, as anyone can get their message across without using direct words. The last one is assertive communication. These are people who are direct, honest, and respectful. They try to get their needs met while also meeting the needs of others. They'll listen and negotiate. Being more assertive in their communication will improve how they feel about themselves. It will also improve their relationships and interactions with others, and this will help increase their self-esteem. Becoming assertive takes time, effort, and practice for clients. It can be uncomfortable and scary, but it is the healthiest way of communicating. It can also be challenging to be assertive if you grew up surrounded by people who communicated in passive aggressive ways. After clients have a good understanding of the 4 basic communication styles, we should help them on developing assertiveness with the following skills: deciding on priorities such as reaching a goal, improving a relationship, or feeling good about one's choice, making requests in a way that doesn't damage relationships by describing the situation and related thoughts and feelings, negotiating, obtaining information, saying no in a way that doesn't damage relationships, or acting in accordance with personal values and morals. Some additional techniques for assertiveness that may come in handy for clients are to listen mindfully, validate, think dialectically about the situation, adopt an attitude of openness, and only apologize when an apology is genuinely called for. To conclude this chapter discussed, deepening current relationships and developing new ones. A relationship needs to be taken care of on a regular basis, not just when something is wrong. And to take care of them, we have to show others they are important to us. Many people avoid speaking up because they are afraid of the consequences. However, not speaking up will build resentment. By speaking about their feelings and discussing problems can make their relationship healthier. For clients who do not have meaningful relationships, it will be important to help them make these relationships. And for clients with social anxiety, it's especially important to help them find ways of deepening relationships that will make this goal more achievable. And that often means taking small steps. Sometimes for clients, deepening relationships is not possible. So, as practitioners, we need to help these clients in a non judgmental and safe way. This brings us to the end of our book review on the book DBT Made Simple. Thank you for listening.